Welcome to Sky Women. I'm your host, Dr. Carolyn Moyers, a wife, mom, and board-certified OB-GYN. This is a place to educate, empower, and inspire. Join us each week as we share the power of women's stories. Real women, real stories, real inspiration. Put on your stretchy pants. Let's get going. Welcome, Sky community. Welcome back to another episode of Sky Women. And I have in-house with me today, student Dr. Marx, who has been on rotation with me for this last month. And we wanted to talk about secondary amenorrhea today. And say what? Like, what are we talking about? I know that sounds like a mouthful, but we're going to be talking about periods and when things go wonky with periods. And we thought that this would be kind of timely, as we've seen a lot of patients with irregular bleeding, abnormal bleeding, elevated prolactin levels, what's going on, what's causing this, and also the recent release of the movie, Are You There, God? It's Me, Margaret, which is a Judy Blume book that we all grew up reading. And many young girls were like desperately praying for their periods to come so that they felt normal.
Exactly.
So this will be a fun topic. Because as you get older, you're like, those periods can go. Thanks. It's been a good run. See you later. Okay, Murphy. But first, I'm going to introduce you guys to Murphy because it's fun to meet our upcoming physicians. Murphy, why don't you tell us a little bit about yourself and where you're from and what you're doing?
Okay, well, I'm originally from Kansas City, but I go to TCOM, which is one of the medical schools here in Fort Worth, and I will be applying for OB-GYN residency this summer to hopefully start next year. I love helping just this patient population through all the challenges of being a woman, and when problems come up and you don't know what to do, I love being there to help them figure out what's going on.
Yeah. So what was it about OB-GYN? Could you do all the rotations?
Yes.
What was it about the specialty that kind of drew you in?
Absolutely. I feel like a lot of it was just personal experience and knowing that as like a 20-year-old girl that things happen, you just don't really understand what's going on. Mm-hmm. And having someone that you can trust and confide in and ask those questions. And also just helping patients advocate for themselves and their bodies and wanting to feel their best.
Yeah, absolutely. I love helping women also. And it was in med school at JPS, actually, where I fell in love with OB-GYN. So yeah, nice to have a fellow TCOM student here today. Okay, so when we talk about periods that have gone wonky, or where has my period gone, let's kind of define what that big word secondary amenorrhea means.
Absolutely. So secondary amenorrhea is when you've already had like that first period of getting your period and suddenly it'll just goes away. And so it should be essentially 3 consecutive months without a period after you had been having them regularly.
Right. So I feel like then we need to walk it back, which we have talked about regular cycles and when your cycle should appear and all that on other episodes. But when we think about this topic, I think it's important for us to kind of define what does a typical menstrual cycle look like? When should we be expecting that? And then when expecting it to go away? So we'll just touch on that briefly that, when we're keeping up with our menstrual cycle, a menstrual cycle is counted from the first day of bleeding of one menstrual period to the first day of bleeding of the next menstrual period. So that gives you an idea of your window or whatever of your cycle. And typically that's between 21 to 35 days, with the average being around 28 days, a typical period lasting 2 to 7 days, and the heaviest bleeding being those first 3 days. Now, it's considered primary amenorrhea if you never get your period, especially if you never get your period by the age of 15. We do recommend that a young person would see a gynecologist by the age of 13 if they have no secondary sex characteristics. So we're not getting any hair, pubic hair, or hair under the arms, and no breast development. So that's when we need to go see a gynecologist earlier. But by the age of 15 is your primary. Your secondary is our cycle has come. We've had that menarche, and then cycles have started to regulate, but then they disappear, right? Okay. And so as we walk through, like, where did my cycle go? What's happened here? Where do you want to start with that?
So we can kind of start from the top and what's considered the most common cause of secondary amenorrhea.
Well, wait a minute. I do want to say, sorry, did not mean to interrupt you,
absolutely.
but a lot of times we're lousy about keeping up with our cycle.
Absolutely.
Right. And then it may be like, oh, when was your last cycle? And we're not keeping track of it at all. So one of the first steps is keeping a menstrual diary. Can you speak to that? And then we'll go into common causes.
Yes. So there are so many different ways to keep a menstrual diary. Some people prefer to use like an actual paper planner or just a calendar in their phone, and they'll mark the days that they are on their cycles. So when they are having their period.
And there's also an app for that.
There's so many apps. And if you have an iPhone, there's the Apple, just their health app that you can just track your cycle on that. You can track your symptoms, and it will even send you a notification a week before you're supposed to start. So you're kind of on alert and you can kind of be prepared for that. It's easy to do. And then whenever you do go into the gynecologist and you get asked that, what was the first day of your last period? You're able to look at your app and you can just tell them right there.
Yeah.
So you don't have to really try to remember the whole last month.
Yeah. And it really helps tracking cycles whenever we're wondering what's going on or what is the cause. It's much easier to make sense of it. We can actually see what that pattern is.
Absolutely.
So, okay. Back to the common causes.
Yes. So there are so many different causes of secondary amenorrhea. And one of the most common ones is pregnancy. Mm-hmm. Someone will notice that they just haven't had their cycle in a month or two, and they'll come in and be asking like, what is going on? And so one of the very first things we do is just doing a pregnancy test, because that's an easy way to either figure out the exact cause or know that we need to go down and do some more investigating.
Right. So other than pregnancy, which we've seen one of those this month as well,
yes.
Where has my period gone? Things seem to be very irregular, and it was a pregnancy. We've also seen elevated prolactin levels, and sometimes that's related to stress or other medications that have been taken. And I've seen this a lot of times in like college students who are in their first year and left home and are all kinds of stressed out, and their cycles tend to disappear with that. The prolactin level, when we rechecked it, had normalized, and then others, we have to do an MRI of their brain to see if they have a prolactinoma, which could be a reason.
Absolutely. And then some other causes that we've also seen is PCOS, which is polycystic ovary syndrome. And so sometimes they'll come in and they'll have really irregular cycles. They might be having other symptoms, such as like chin hair and acne, or even like trouble losing weight and excess stress. And so usually for that, we will send them for an ultrasound to take a peek at their ovaries to see if there are cysts on those ovaries. And then we are able to treat it medically with some medicine.
Right. And we also do lab work with that.
Absolutely.
Looking for elevated androgens and other causes.
Yeah.
And one of the other causes is thyroid disorder. So, and this is true. This secondary amenorrhea may be seen at any period in life. And so we're not just speaking to, teens or 20-year-olds, it's 30s, 40s when cycles tend to go wacky as well. Is this perimenopause? Am I entering menopause? Like, what's going on? And so really something for us to take into consideration at all stages in life, but particularly thinking about thyroid disorders that we can see a lot of times in midlife. Is it hypothyroid? Is it hyperthyroid? What's going on?
Absolutely. And then some other ones that can be seen is one called premature ovarian insufficiency, or POI, which essentially means that you kind of almost go through menopause before the age of 40. And so again, we'll do lab work and we'll be taking a peek at levels like your FSH and see what's going on, essentially what would have caused this and where we are.
Yeah. And we renamed that. It used to be called ovarian failure, which, I mean, a lot of women do feel like their ovaries failed them, but it was a very defeated name, Yes. So the premature ovarian insufficiency is a little kinder, I think. Yes. Okay. And so why does it matter? Like, I don't have a period. Yay. I'm done. Why does it matter?
So it's helpful just to have a period and to know exactly what is going on, especially if you're trying to plan for a family and wanting to get pregnant, or not get pregnant. It's helpful to know what exactly is happening with your cycle. So if you are trying to have a family and you need to have like a regular cycle to coordinate your schedule with that, there are ways that we can help intervene and figure out what's going on.
Yeah, if you're not having a regular cycle, you're not ovulating and therefore would not achieve pregnancy. But say somebody who's in their 30s and they're overweight and they've always had irregular cycles and they think, well, I probably don't need to do anything about this. It's cool. I don't have a period. Are there concerns? Is there a reason that we should be wanting to treat this?
Yes, absolutely. So one of the concerns could be that if there is something going on with our ovaries and we're not essentially making enough estrogen and our estrogen starts to decrease, our bones actually can get weak and you can have osteoporosis because the estrogen kind of helps block the little cells that kind of break down our bones. So that's something that happens in women who have gone through menopause. And as we get older, our bones tend to get weaker. And so if it happens earlier on in age, that puts us at risk for fractures and just injuries like that. So we have to make sure that it's not a cause like POI where our estrogen starts to decrease.
Well, and also if it's PCOS, we may have risk of diabetes that we're ignoring or insulin resistance. We need to protect the endometrium or the lining of the uterus against hyperplasia or malignancy. And so there definitely are reasons why I always say, like, if you are not having periods because you're on hormone therapy, wonderful. If you're naturally not having periods and we're not menopausal, it's not okay. It needs to be addressed.
We got to do some work. And there could be other causes of the secondary amenorrhea. Some of the ones that are I feel like the classic ones that we're always taught in medical school is if someone who's working out a lot, and usually someone who's training for a marathon or a gymnast. So excess exercise or decrease caloric intake, that can cause for your period to go a little crazy.
Right. So low body weight, you have to have about 10% body fat in order to, if you're 10% under normal weight for you, then you don't have enough body fat to produce hormones that you need, and you can become amenorrheic. So yes, I love that you're addressing all of those.
Yes.
Anything else that we haven't hit? We talked about stress, low body weight, rapid weight loss, eating disorders, PCOS, thyroid disorder, and premature ovarian insufficiency. I think those hit the highlights.
Absolutely.
Yeah. So treatment plan is going to be very individualized. It's going to be very unique to each individual and what the underlying cause is. So it's important to get in with your healthcare provider and kind of advocate for yourself now, knowing that if my periods just disappeared, probably something that we need to address, because there are medications and hormonal therapies to help manage that. And there's also like lifestyle modifications. For instance, for my patient who was a freshman in college and away from home, we did a progesterone challenge to see. So we gave her progesterone for 10 days and then she had a withdrawal bleed. So we said, okay, great, things are functioning properly. And so then we looked at options for stress reduction, balanced nutrition, et cetera. And her periods returned to normal and they were delighted.
Exactly.
Yeah. Okay. Anything else you want to add?
I think that covers about all of it.
Yeah. So I think it's just really important to be your own healthcare advocate. Know that if something has gone awry with your period, track your cycle for at least 3 months and bring that in. If you've been 3 months without a cycle and your pregnancy test is negative, we need to investigate what is going on. If you are in fertile years, you're not menopausal, you should be on a prenatal vitamin. That's just kind of my standard across the board recommendation because most pregnancies are unplanned.
Right.
And so that will help with having that folic acid on board if you should have a surprise pregnancy. But otherwise, I think we kind of covered it. So any additional questions you have, just let us know. You can find us at Sky Women's Health. Murphy will be moving on to a new rotation come Friday afternoon, and we will miss her terribly. But thanks for listening. Until next week, be well. All right, Sky community, thank you for listening to another episode.
This episode was sponsored by Sky Women's Health. As a reminder, we're in the Dallas-Fort Worth area, and we help relieve back pain and pelvic pain in pregnancy and beyond. If you are pregnant and having pain and you feel like you have no reliable way to relieve it, look us up at skywomenshealth.com, request an appointment, and we'll call to get you scheduled. As a board-certified OB-GYN with a neuromusculoskeletal medicine fellowship, I help you realign with hands-on drug-free treatment and relieve pain on the spot without medication. We'll help you maintain these results through your pregnancy and postpartum period. Every pregnant person deserves this, and we are so excited to serve you. You can find us on our website, as mentioned, or on social at Sky Women's Health, or you can call the office at 817-915-9803. That's it for today. Until next week, be well.